Hi, everyone. Welcome to Chats with Dr. Gege. I'm a pediatrician, a pulmonologist, and a mom of two. And just as a disclaimer, I am not an obstetrician or gynecologist. But today I am going to talk about pregnancy in your late 30s and 40s. If you've been following our series, you will know that I've just had my second born, and this was a pregnancy at exactly the age of 40. So today I want to just talk about what it entails to be pregnant in your late 30s and 40s. What are the risks, and like what you can expect. So first thing is that I would hope that when you find yourself in this situation, it's not by accident, and that it's actually planned. So when you are deciding that it's time now to either have your first child or expand your family, you will go and consult your gynae and share this decision with them, because there are some checks that should be made even before you actually start trying. Okay. So I would advise that you actually plan for pregnancy, especially because pregnancy after 35 and in your 40s is actually considered to be a high-risk pregnancy. So first things first is to prepare. How do you prepare? I think it's by being healthy. So trying by all means to be healthy. If you know that you have any underlying chronic condition, to try and get that under control. Make sure that you're not on any medication that is what we call teratogenic. So there are some anti-epileptics or some antiretroviral medication, or even some medications for autoimmune conditions that are actually known to be harmful to fetuses in utero. So you need to have that chat with your doctor to find out if there's any medication that needs to be changed, swapped out, or stopped. Secondly, it helps if you're in good shape physically. So by good shape, I don't mean like size 30 or whatever. I just mean in your best physical fitness level, essentially. So if you can, try and get moving, work out. You don't have to be a fitness bunny, but at least just try get some exercise in, try build some muscle mass, and start watching what you eat. It does help if you can cut down on alcohol. I would ideally say actually stop drinking. But what is also important when you're trying to conceive is to try and just, they say try and relax, which is also not easy when you've been trying to conceive for some time. So I would say if having a glass of wine is part of your social relaxation time, then maybe you don't need to entirely stop. But the hope would be that you really are monitoring your cycle so that as soon as you do conceive, you are not caught in that window where you are actually ingesting alcohol and not knowing that you're pregnant. So yeah, speak to your gynae or obstetrician, do the pap smear, get your breast checked, make sure that everything is fine, and then you can give that a go. Right. So if you're fortunate, you may be in that lucky group of people who just try and instantly fall pregnant. But it is known that in those years, it's not just easy to conceive. The egg count is starting to significantly decline from 35. And from 40 onwards, it's significantly less. I'll try not give specific numbers and figures, just to try and keep our chat as simple as possible. But yes, falling pregnant in your 40s is not going to be as easy as it could have been in your early 20s. So what are the risks, right? So one risk is that conceiving might be difficult. It just might not be as easy as if you were younger. So if you've been trying for 6 months or more to conceive, and it's not been happening, then I think you should actually speak to your obstetrician about it. And by trying for 6 months, we really mean that you are having regular sexual encounters with your partner. If you're not engaging, then you're not trying. Okay. So yeah, so that's 6 months and more of trying and not conceiving. You could now be entering the realm of secondary or even primary infertility. So you do need to speak to obstetricians. You don't want to wait too long before you seek help at this time, because literally every month actually counts. Okay. So the risks that are involved now once you are going to be pregnant in your 40s, one is hypertension. So you could develop high blood pressure. So when you are pregnant, you will be seeing your obstetrician either every 4 or 6 weeks, and they will be checking your blood pressure, checking your urine, because a severe high blood pressure can cause a condition called preeclampsia, which is dangerous to a developing fetus. Another thing that may develop is gestational diabetes, so they will be monitoring your blood sugar levels. So much so that even if you don't develop diabetes, you are going to be sent to do something called a glucose tolerance test. A glucose tolerance test is a test where it basically checks your risk for developing diabetes, just to see how your body handles sugar. So you will be sent to a lab, one of the several that we have in our country. It's a test that you will need to have. Your last meal will have been dinner. You'll be told to eat nothing from midnight. So you're pregnant, you're probably in your second trimester, and you're being told to not eat anything till the morning. You get to the lab 7 o'clock, 8 a.m., and they will take a blood sample. Once they've taken that blood sample, you will be given about a cup or a glass full of this wonderfully thick, extremely sweet, syrupy drink to drink. And you will have that in your tummy. You have to finish the entire glass. Good luck. And then you'll be asked to wait. So you've been starved overnight. Now you've had this very not so yummy drink, and then you'll be starved for another 2 to 4 hours. You can have nothing else to eat. And then you will go back to the lab, and then they'll take another blood sample to see how did your body actually handle that glucose drink that you had. So your doctor will interpret those results and see what your risk is for developing gestational diabetes. So those are some of the risks that can happen to mom. And then there are risks that can happen genetically, just by virtue of us waiting to have our little ones. So there are several genetic conditions. I won't list them here, but the popular ones that everybody knows is trisomy 21, which is also known as Down syndrome, trisomy 18, trisomy 13, and why these are they've spoken about quite a bit, and why it's a bit of a scare is because babies born with these conditions can have some serious health problems. One of the main ones being intellectual disability. But they can also develop heart conditions. Sometimes the hearts don't develop normally, and the septum in the heart doesn't actually close. They can have kidney problems. So there are several organ abnormalities that children born with specific genetic disorders could have. And so some parents or couples actually prefer to know this in advance so that they can actually make the decision of whether or not to go through with the pregnancy or not. So if that is the case, your obstetrician will discuss this with you and will tell you about the different screening and testing options. So a screening test is essentially a test where we are just basically looking at, is it possible for you to have a baby with this condition? The test is not going to tell you exactly that, okay, 100% this baby has Down syndrome, but it's just going to tell you that your risk compared to the next person is up by this much. And then from then on, you will then be advised if you actually need to do a confirmatory test. So how do we screen? So in the first trimester, you will have had an ultrasound done. So whether it's transvaginal or through your abdomen, but your obstetrician will actually look at the fetus, and there's certain measurements that they do that can give a hint as to whether or not this is a normal fetus or not. Okay, and ultrasounds essentially throughout pregnancy can give ideas as to is this a normal fetus or not. And ultrasound is not a diagnostic test. They do not always see everything. So an ultrasound can be done by your obstetrician, or it can be done by a technician, an ultrasonographer, who is actually not a doctor, but someone trained in doing these ultrasounds. Okay, so if your pregnancy is considered high risk, and by virtue of having a baby post 35 or 40, your pregnancy is automatically labeled as high risk, you will be advised to do something called a fetal anomaly scan. A fetal anomaly scan is an ultrasound that is done by a specialist, okay, who's also a gynae, but now has actually specialized in fetal medicine. And this is an ultrasound where they basically like zoom in on like very specific organs of your baby in your abdomen, and then they look for certain abnormalities which can give clues as to whether or not everything is fine or not. But they will give you a whole talk and prepare you for the scan. They will explain everything that they do, and they will explain to you what they're seeing, and if they're seeing something, what it means. But they will also be very careful to remind you that just because we are doing the scan and we are not picking up anything abnormal, it does not mean that we are 100% sure that everything is going to be fine with your baby. It will really only be known when your baby is born if you are having a perfectly healthy baby. But that fetal anomaly scan is a very comforting one, because it really does pick up most abnormalities, if there are any. I mean, at fetal anomaly scan, if you're told that, look, the heart actually looks normal, I think you can really take comfort that your baby's heart is normal, or they tell you that the brain really looks structurally normal. I think you really can take that into account. But just bearing in mind, and I think just for medical legal purposes, that it is not 100%. Okay, so those are the scans that are done to look at your baby. And then remember the 3D and the 4D ultrasounds and videos and pictures that are taken of your baby. Those are for you. Those are for memories. Those are just to look at the baby's face, who does the baby going to look like. But those are not anomaly scans actually looking at the baby's organs and structures to check that this baby is normal. Okay, so those are the ultrasounds, and that is still part of screening. All right, then now we move on to still some other non-invasive screening tests. Another non-invasive screening test, which is not done routinely but will be offered to you as an advanced age pregnant lady, is one called an NIPT test. So this is a blood test that is done on mom. So your blood is taken and sent to a special lab, and what they do is that they then will filter through your blood to try and look for genetic material from your baby. So as some cells from your fetus are shared, some actually filter through to your blood system, and so those can actually be looked at. And these tests actually have like a 97 to 99% pickup rate of whether or not your fetus may have any genetic or aneuploidy abnormalities. They can even predict the gender of your baby. And this is like from about 10 to 14 weeks already that these genetic tests can be done. So many, I don't know if not all gynaes will offer this test to you. It's not a compulsory test, so you can opt in or opt out. But before then, they may actually do other screening tests based on certain calculations. So they'll take your age. So say you are 38, and they'll use your age of 38, and they will have done some hormone level tests in your blood, and there's a formula that they use, and they'll say, okay, based on your age and how high your HCG is and this other hormone, your risk stratification for having a baby with Down syndrome is now falling at 1 in 200, meaning you have a 1 in 200 chance of having a baby with trisomy 21. Hearing news like that, depending on what you know and what your preference is, it may actually make your heart skip a beat. But remember, again, it's just a screening test. It's just risk stratification. So you would still then need to do other tests to sort of give you a more accurate answer, of which the NIPT is one of them. Okay, and then the invasive tests that can be done, which though are now being replaced by the non-invasive tests, are the chorionic villus sampling and the amniocentesis tests. And these are becoming less popular because as much as it's a low risk, the risk is there of a miscarriage, because with the chorionic villus sampling, they actually do stick a needle into the gestational sac around it to get to those villi and take a sample of that. And this is done in the first trimester. With amniocentesis, a needle is actually stuck through the amniotic sac to get some of that amniotic fluid. So you can imagine that this is invasive, the amniotic sac is getting a small hole pricked into it. So there is a 1 to 2% chance of miscarriage. But if you're wanting to get a definitive diagnosis, then that would be it. So some people do these tests, and some actually say, you know what, doc, we are happy to just do the ultrasounds to just look at the fetus. And if you're going to tell us that the brain looks normal, the heart is normal, then we don't mind. We don't mind if the baby actually has a genetic abnormality, even though we know that at least the heart will be normal, so our baby won't need surgery. But some people want to do all the tests because they actually don't want to have a child with any genetic abnormalities. And then now we're entering into the realm of to terminate or not to terminate. And that is also going to depend on your spiritual beliefs, etc. So we're not going to go into that right now. So those are sort of like the medical things that you now need to bear in mind when you are having a baby in your late 30s and 40s. But apart from that, physically, pregnancy in these advanced ages is known to just be more strenuous on the body. So just remember already, like your bone mass and your muscle mass are starting to slightly be on the decline. So the fatigue of pregnancy, which is part of every pregnancy, is that much worse in these advanced ages. So be prepared to just not be in the mood for anything. Be prepared to have your sex drive literally be like in your boots, okay? Be prepared for some muscle aches. Any muscle can cramp, from calf muscles in the middle of the night to bum cramps when you're walking to back aches, So if you are able to, then I would suggest that you actually go for those preggy massages, take your supplements, take all your pregnancy supplements. But another supplement that can help with the muscle aches is magnesium. So slow mag is something that you can add to your lifestyle now, because I am assuming that you're now eating very healthy. Not to say you can't treat yourself with some junk every now and then, but please do take your supplements. Actually, even from before you fall pregnant, if you know that you're wanting to fall pregnant, and that if you're actually struggling, to get some slow mag. And it is suggested that you continue to move, that you exercise, but I know that it's hard. And if it's not hard now, it is going to be hard. But, just try. If you're not able to work out or lift the weights that you used to, then just take walks or go for a swim in a heated pool if that's what makes you feel better. Okay, but it is possible. And the numbers are actually going up now of women that are having healthy babies in their late 30s and 40s. So if this is your dream and this is your plan, I encourage you to go for it. But you need to go in it with the awareness of the fact that the risks are higher and there's slightly more work that you're going to have to put into it, and that it's not necessarily going to be an easy pregnancy. Thank you.